Hi, I'm Dr. Adam Fields. I'm a chiropractor. I'm honored to have Tim Sawyer, physical therapist here, who's published in the Trigger Point Manual by Simons and Travell. Let's do some trigger point work for your shoulder.
Hey guys, we're going to do the Subscapularis with our thumb. Adam's going to demonstrate on his left hand. You take your thumb and you put it deep into the armpit, and then you cross the arm over, and then you want to push that thumb deep into the armpit towards the outside.
If you're not feeling it, you're not on it, people.
Yeah.
This is good. We've hit so many home runs in our office with just working the subscapularis.
Yeah, this muscle is commonly found in pretty much all shoulder pain patients, so this is a great one for you all to practice. Again, with the thumb deep in the armpit, you want to hold that, you want to greet the pain. Once you find the pain, if it's too much, you can back off a little bit and then breathe. In through the nose, out through the lips, nice and slow. 3 or 4 times, anywhere from 30 to 60 seconds. Just breathe with us through this, releasing this subscapularis.
If you're wondering if you're on it, if you move your shoulder like this,
yep, you could feel
it move a little bit.
And dig a little deeper. We call it taking up the slack. Find that pain. You can move around in different positions and really release that muscle. And when you're finished, back off gently and just relax.
And feel that movement.
Really increased range of motion right off the bat and less pain. Next one's the pec minor. Let's get you on your stomach. This one, with the use of a lacrosse ball, you could palm the lacrosse ball in your hand, and you're going to place it right on your pec minor.
Right here, underneath this bony protuberance, right here, underneath your clavicle. And we're gonna go right into it.
And you breathe slowly again. You want to greet the pain, and you want to hold it for about 60 seconds. That pain should slowly decrease.
No grimacing, only relaxed face.
No guarding. If you're pushing too hard and the pain is too much, one thing, you should never ever bruise yourself. If you're bruising yourself by doing this, you're pushing way too hard. Nice deep breath. About 10 more seconds. How's that feel?
Feels like it's releasing.
Great.
You can almost feel it just melt a bit.
Folks that have shoulder pain that sit at a computer all day, this is perfect for you. All right, now let's go to the next one, the Infraspinatus. So you want to lie on your side and face this direction. Let's use this white ball. I think it'll, and this little head pillow or a yoga block. The Infraspinatus is right in this position, so we really want to get right on that with the ball. This could be really intense, so you want to take it really slow until you find that hot spot. Then relax your head and gently breathe through it. Are you finding the pain there?
Oh yeah, exquisite pain.
Great. This could refer down the arm into the shoulder, a huge shoulder referral. This muscle, trigger points in this muscle, could also create some weakness in the arm. So as you release this muscle, you will also feel some blood flow coming back in the area, some strength coming back.
Great to do before a workout if you're working for your front deltoids, to release the teres minor first.
All you folks that have gotten into the pickleball craze, I've seen you in my office for this stretch. You all have these trigger points, so it's great for tennis, pickleball, any kind of racket sports or throwing sports. Beautiful. And then if you roll back off that ball to get to the teres minor, you just roll it down a little further on the shoulder there, and you'll find that teres minor. These can be very tender, so you want to take it really slow as you roll onto that ball. How does that one feel? Yeah. So if it's too tender, all you do is roll off the ball just gently. And if you feel that you can handle more tenderness, then you roll back onto the ball just slowly. Taking deep breaths, nice and slow, in through the nose, out through the lips. And that's beautiful. After the teres minor, you could roll over this way, and you want to hit the back of that shoulder right in here. And these can be really intense, so you got to take it slow. And you hit the deltoid. And you could roll, if you roll backward, you'll get to the back of the deltoid. There. Let's hold that one a minute. Nice and slow. Again, breathe gently. If it's too painful, you have the ability to back off a little bit. And as you want to get towards the middle of the deltoid, then you slowly roll the shoulder back into the middle there. Beautiful. Hold out. Trigger point release. Releasing slowly. It's important that after you do these trigger point releases that you follow the stretch video, because the stretches always follow trigger point work and add some great relief to the whole process. And then if you roll even further forward, you'll get to the front of that deltoid. There we go, right there. And that's a really intense, beautiful stretch. So always take it slow. You have complete control when you're at home doing this to put more pressure or less pressure just by changing your body positions. Nice deep breath. How do you feel that one?
It feels so
And it's great. In this position, you've just done Infraspinatus, Teres minor, and now the deltoids. Now if you want to get to the rhomboids up here, then you take the ball and you roll backwards, and then right on that rhomboid, right there.
between your spine.
Right in between the shoulder blades. And you could roll back on it. And again, if you need a pillow, you could just use a yoga block or a pillow or a ball. The key thing is that you want to be comfortable and you don't want to guard while you're doing this. Take a nice deep breath. Let it out slow. And the rhomboid is about 4 inches long. After you do a couple of stretches, you could roll back this way and bring it down a little further and hit it again.
Right, just thinking about a stressful situation will tighten a trigger point.
Exactly. A stressful phone call, a stressful meeting. Any increased stress can activate trigger points and send them into a full pain behavior. And so deactivating these trigger points, breathing helps to decrease your stress levels.
Bring on the parasympathetic, right?
And once you deactivate trigger points, then you can check out the yoga videos, because yoga works great once you've released trigger points and it keeps them released. So be sure and check those out as well. Now go ahead and sit up, Adam. The next one, face our wonderful folks at home. We're going to release our own scalenes with a ball. And the scalenes are hanging out right here. So we really want to just put that ball just above the clavicle. We don't want it too far forward because that'll be on the carotid artery. If you feel a pulse rate, you want to back off into this little corner here. And sometimes if you just close your eyes and move that ball around, and if you just put your arm now in the back and tilt your head up and push a little harder with the ball, you should find those trigger points. You finding those? Then you can come forward just a little bit and down right there. Beautiful. So one of the things you could do as you get your arm in position, find your clavicle, and then just come right off the top of it. And it's in front of the upper trap, right into this little beautiful crevice here, and that's the scalene.
Some of you might feel more comfortable even with your hands. You can get in there and even strum it a little bit.
Right. There's 3 muscles there. There's the posterior scalene, the middle scalene, and the anterior scalene. So you just want to work this whole area and find some tenderness and gently release it. Once you're finished with this one, then you could relax the arm and come up to the top of the shoulder and hit the upper trapezius. One thing that people do is they could sometimes feel more comfortable finding the trigger point with their fingers, then grabbing the ball and adding the ball pressure. And then it gives you a little bit of a kind of a extra benefit to kind of really feel what you're feeling.
Do you like putting the muscle under tension while you're doing it?
Well, sometimes it's beneficial to give it a little tension, and sometimes if it's too tense, you can actually shorten it up a little bit to find the trigger point. The key thing is you want to be comfortable. You don't want to be in so much pain that you're guarding and grimacing. Guarding and grimacing is against the rules when you're doing trigger point release. And when you're in the upper traps, you could roll out a little further and roll around. The supraspinatus is deep to the upper trap, so it's kind of hard to get it with the ball. You might have better luck.
I got it.
With your fingers deep into this, just deep into that upper trap, way out towards the shoulder, and you'll find a real hot band that's just, and you could add then that stretch with the arm across the back of the body, tilt the neck down, and you can strum this muscle. And this could really give you a lot of relief of this shoulder pain. Looking good, guys.
Beautiful. Thanks so much, Tim.
Yeah.
All right, go ahead and follow this up with the shoulder stretching video. And thanks for taking care of you today.